Hello, my name is Amy Sturkey. I am a pediatric physical therapist with about 33 years of clinical practice. And on today's video, we're talking about torticollis. And we're specifically targeting right side torticollis. What that means is that the right sternocleidomastoid, this muscle right here, gets tight on children. And so that makes them, when it's tight, makes them laterally flex to the right and rotate to the left. And when a baby has that condition, you need to make sure one of the staples of what you do is work on aggressive repositioning of the baby throughout the day. And so you look at all the things you do during the day and change it so that the baby has to look to the right instead of looking to the left. So one of the things that you do throughout the day is you feed your baby. My co-instructor here is Bodhi, and he does not have right-sided torticollis, but we're pretending. So one of the things you want to make sure you do is when you feed Bodhi, or a child with a right-sided torticollis, is you feed them so he has to look and turn to the right. A lot of my families tell me this is the most successful they are throughout the day. If a child is particularly resistant of repositioning their head to the right, the feeding is their best chance at getting their head turned to the right. So Bodhi is demonstrating this perfectly on how to take the bottle with his head turned to the right. As a part of the aggressive repositioning program, this is an option for feeding. If a child has right-sided torticollis, you want to try to get them to look to the right while they're being fed. So by having crossing your left leg over your right, he can look at you and turn off to the right. In terms of positioning for children who have right-sided torticollis, that means that they are tight on their right side, they tilt right, but they look left. You want to make sure that they're in their bed so that they can look out to their right to see the world, because they like to look left. And when you lay them down at night, so it's back to sleep now, you want to make sure that you turn their head to the right before you leave them for the night. For a child with right-sided torticollis, you want to make sure that he's looking out to the right from the changing table. So you want his head to your left so that he's looking out to the right when you're doing the changing table. For children who have a right torticollis, they want to tilt their head to the right. So in a car seat, what you may need to do is just add a towel roll to one side to help tilt their head off to the other side. What they say is that you need to be very careful that you're using this when the child is supervised. You should not do this when they're in the car, because you don't want this to come down and choke your baby. So you want to make sure that when you're using something that's not tied down to the car seat, that your child is supervised. So this is how you do it when a child has a right torticollis. They're tilting their head off to the right just to help block their head off to the left. The last thing to think about with aggressive repositioning is to significantly limit container. So when you think about containers with babies, that's like car seats or bouncy seats or rockers or swings, particularly car seats. Certainly you can use a car seat when the baby's in the car, or if you're in the grocery store and have the baby in the car seat. But other than that, you're supposed to limit car seat use to 15 minutes a day and significantly limit the times in the rockers and the bouncers and the swings. Because in those positions, for children who have either right side or left side torticollis, it really is a position that encourages that asymmetrical posturing of the head and neck. I hope this video talking about aggressive repositioning is helpful for you. Bodhi's asleep now, so imagine him saying bye with me. Bye, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.